We're joined now by Dr. Ashish Jha. He's Dean of Brown University School of Public Health. Good morning to you, Dr. Jha. You just heard Maria's report that even eligible people are having a hard time. Getting the vaccine that's so badly needed. So what needs to be done to turn this around?
Yeah, it's a good morning, Gail. Thanks for having me on. A couple of things. First of all, obviously, we just need more vaccine doses, and that's coming. It's still frustrating to have to wait. But the second is the complexity has to be made a lot more simple. I don't understand why people have to get up early in the morning and be on the computer all day. We should be able to come up with much, much simpler systems. When you look at states that are doing a great job, they've made it really simple and easy for people to get vaccinated. I think all states should be following that rule.
I know everybody agrees with you. This should not be this hard in 2021. Let's talk about the new direction from the CDC yesterday that 2 masks are better than 1. You're more effectively covered. A, do you agree with that recommendation? And B, how in the world are we going to get people to wear 2 when people are arguing about wearing 1?
I know. Right. So 2 things. I mean, first of all, I do agree with that recommendation. That's what I've been doing for probably about a month or so, and it's nice to see CDC come out with data on that. The point I think that's really important for people is you don't need to wear 2 masks at all times at all. When you're out and about in the public, if you're not around in crowds, any mask, 1 mask is totally fine. The 2 mask situation is really for high-risk things. So if you're going to be in a grocery store for any extended period of time, if you're going to be indoors with a lot of people who are not part of your household for any extended period of time, you start with that surgical mask and you just put a cloth mask on top of it. You get a much better fit. You get better filtration. It is just much, much safer. You should hold those for high-risk situations. You
said you started wearing 2 masks a month ago. Why did you start doing that and didn't tell us about that? I didn't know you were doing that, Dr. Jha. I'm thinking maybe I should have been wearing 2. What made you start doing it a month ago?
I don't mean to hold out on you, Gail. And the reason I started doing it is because of these variants, and especially the UK variant, which is so much more contagious. And as soon as I knew it was here and it was starting to take off, I started changing some of my practices.
Okay.
There are other alternatives as well. You can get a high-quality mask, but I do think it's important to be wearing good masks right now.
Yeah, and let's talk about those variants. Do you think that they're now outpacing the vaccines?
That's what I'm worried about, and I think those variants, especially the UK variant, is here. It's probably in every state in the country. It's doubling. The numbers are doubling every 10 days of that, and by mid-March to late March, it'll be everywhere. That's our target. We got to get high-risk people vaccinated by then. Some states will do it. I'm worried that other states won't.
Let's talk about the opening of schools. The Biden administration said the other day that they're now going to focus on mitigation efforts like wearing a mask as opposed to focusing on vaccinating the teachers. What do you think of that plan?
I think that's exactly right. I think we have very good evidence now that if you do mitigation, if you get people to wear masks, if you make sure there's reasonable ventilation, if you can do a little testing in schools, all of that makes schools very safe for kids and teachers. Again, look, if we had plenty of vaccines, it'd be great to vaccinate the teachers, but I don't think that's an essential feature of getting kids back to school.
All right, Dr. Jha, it's always good to have you here. Thank you so much.